Chair now recognizes the ranking member of the Subcommittee on Military Personnel, the gentlewoman from Pennsylvania, Ms. Houlahan, for any comments she would like to make.
Thank you, Mr. Chair, and I also want to echo my appreciation to the Ranking Member Smith and to you, Chairman, for the work that we were able to accomplish last cycle in terms of quality of life and the opportunity that we have to continue to build on that. I also want to make sure that we collectively thank Chairman Fallon and all of the members of this subcommittee on both sides of the aisle for largely keeping this process not just bipartisan, but frankly apartisan. The American people and those who serve and sacrifice for us in uniform should really demand this of us and deserve this very much from us. So this mark, as Mr. Fallon mentioned, includes many quality of life priorities for our service members and their families, and these issues have an immeasurable impact on our recruitment and our retention efforts, as well as on our readiness. This bill includes a 3.8% pay raise for service members, and it increases the family separation allowance for service members to $400 per month. It also excludes the basic housing allowance from service members' household incomes, so a greater number of them should become eligible for basic needs allowance. These and several other provisions in the Military Personnel Subcommittee mark should very much positively impact service members' pocketbooks and their ability to put food on the table as well. The Military Personnel Subcommittee mark expands ongoing access to provide safe and quality child care by extending the Child Care in Your Home pilot project through 2029. This project provides in-home child care options tailored to the unique needs of military families, many of whom work very much non-traditional work hours. Additionally, the bill requires the department to conduct an annual review of child care fee assistance rates. These regular reviews will ensure that the fee assistance program remains aligned with the ever-evolving needs of our military families and is responsive to changes in child care costs. The Department of Defense recognizes the very critical role that child care plays in the overall mission and in readiness, which is why the largest operator of employer-sponsored child care in the country is here. Although recruitment efforts across the services have improved, this bill also increases access for military recruiters at high schools and at other institutions of higher learning to make sure that we have access to the greatest number of eligible individuals as are possible. And finally, the bill addresses the ongoing health care needs of our servicemen and women and their families. It requires the establishment of an occupational resilience program for cyber personnel to meet their unique mental health challenges. The bill waives fees and co-pays for the TRICARE dental program for all members of the selected reserve, and it also increases healthcare costs and healthcare access by improving the reimbursement of travel expenses for specialty care and by ensuring that the department doesn't further reduce the current number of military medical personnel. This is particularly important at a time when there are medical professional shortages across this country. Our service members and their families make considerable sacrifices for this nation, and we must fulfill our commitments to them and to their families. Finally, I'd like to acknowledge our staff and the committee's staff efforts, Ilka Regino and Michaela Reardon in particular for their fantastic work, and Mr. Yeti, as well as Ms. Kaufman and Sapna Sharma, who is welcoming a little one into the family as well. They have worked tirelessly and diligently to develop this subcommittee package that is before us today, and for that I'm appreciative. I'm also deeply appreciative to Team Houlahan, who are both here in this room as well as back in the office watching and helping. I yield back.
Gentlelady,